Hi, everybody. Today we wanted to talk to you about the nursing shortage. We wanted to talk about the causes of this shortage, the effects it has on nurses, doctors, and patients, have a firsthand look at what this has to do with the coronavirus going on, and just the overall significance of this shortage. So what is this shortage? Well, we have some statistics to tell us what it is. By 2022, there will be more nursing jobs needed than nurses, with over 100,000 per year. More registered nurse jobs will be available through 2022 than any other profession in the US. And because of these and other factors, there will be a higher patient to nursing ratio, causing nurse burnout. When there's nursing burnout, the patients and the nurses aren't very happy.
Hi, I'm Jenna. I'll be talking about causes of nursing shortages. So there's a couple, so I'll just hit the big ones. Nursing burnout is a very common cause. It just means that since nursing is a very high stress job, you feel overwhelmed and overworked, so you choose to leave the profession. Another one is career versus family, and in many cases, family wins, where people choose to spend more time with their family and dedicate more time to them. Another one is that an older population and an older workforce kind of make an imbalance, just meaning that as more people age, they need more care. And as nurses age, they feel ready to retire. So they leave the workforce, which just means less nurses to take care of that aging population. There are some more major reasons that nursing shortages happen. An example is the Great Depression, where there was very high unemployment rates, and during wars and after wars. Another cause is that there's certain fads with professions. And so sometimes being a nurse is more popular, I guess you could say, and other times it isn't as popular. So when nursing isn't as popular, there's less nurses that go in and less people to take care of people. So, yeah.
Hi, my name is Sadie. Nursing shortage has a significant effect on hospital staff. First, nurses are assigned more patients to care for at a time. With this, a nurse experiences much more emotional, mental, and physical stress, causing a decrease in career satisfaction. According to the statistic that Brianna talked about on her first slide, more and more nursing jobs, though greatly needed, are vacant. Unless we fix the nursing shortage, the increased career dissatisfaction by nurses who are still working will cause them to quit their jobs and increase the vacancies. It's an endless cycle where the situation for current working nurses only gets worse. Second, lack of nurses leads directly to overcrowding in emergency rooms. Without the support of nurses and without their help, doctors commit more errors. Overcrowding causes stress and burnout for doctors because of their increased workload. Here on my next slide are my sources.
The nursing shortage also has an effect on patients. Patients who are in hospitals with a nursing shortage may experience a lack of time with their nurses. These patients may not receive personal care and one-on-one time with their nurse. They also may feel neglected because of this. Medical errors also may occur with nursing shortages. High patient to nurse ratios have an effect on medical errors, and an increased workload of nurses and stress puts patients' care at risk. Errors that may occur include wrong medications or dosages may be given to patients. They may not be treated properly. They may incur more infections, and they're more likely to have return visits.
As you might imagine, throughout the last year, we have seen a shortage in nurses due to the ongoing pandemic, also known as COVID-19. The shortage in nurses has less to do with the amount of nurses in the workforce today compared to previous years, and more to do with the massive numbers of patients that hospitals across the country have been seeing due to the pandemic. Before the pandemic, the nurse to patient ratio was roughly 1-to-1, but since has jumped to closer to 1-to-4. The spike has not only caused the hospitals in bigger cities to be at full capacity, but it also has affected the work life of a nurse. In most cases, nurses are the ones who are the primary caretakers of the patients that have COVID-19. So with the shortage in nurses, they have been more exposed and more susceptible to contracting the virus. In order to combat the virus, nurses have been in some cases working longer, more frequent, and physically exerting shifts.
So far in our presentation, we've talked about the nursing shortage. Another really concerning thing is the number of people who don't have access to primary care providers. In 2019, before COVID ever hit, 35% of voters said that they had trouble finding a doctor. Us as future nursing students have the opportunity to help be a part of the solution. Nurse practitioners can give almost the same amount of care as physicians can, while being more affordable and more accessible, especially to the already disadvantaged people that are affected so much by this problem. So a big part of our message today is that as registered nurses, we feel a great need, but we should also think about continuing our education and becoming everything that we can be with the talents that we've been given, and we'll be able to fill a great need. So thanks for watching our presentation.